The socio-economic developments that are impacting healthcare in Africa are many. And we have seen, of course, if you look at access to health services, which is critical, and that is really the vision for the healthcare sector for us as an organization, we have seen increased access to health services generally. Whereas Africa still retains the least percentage of population members receiving adequate health services, we've seen that number grow. And we've seen that number grow, reaching, and the result of that has been a reduction, for example, in child mortality or the death of children and infants. One of the numbers which I like to reflect on is that this organization has been in Africa for 65 years. Within that time, we've seen that the numbers of children who die in infancy has come down from 183 per 1,000 to 47 per 1,000. That's major reduction. And the result of that is, of course, increasing access to water and sanitation, because public health is critical in child survival. Secondly, is access to medical science. Vaccination has improved through access, but government improvement, civil society work by people like ourselves. We've also seen access to other services like family planning, sexual reproductive health and rights. But one of the critical developments that we've seen that's impacting healthcare is actually education of women, reduction of female genital mutilation, reduction of early child marriage, allowing women, girls, to go through life, to go through education, to become women, to decide the size of their families and how their families grow and how their families develop. This has actually impacted health outcomes positively, because at the end of the day, women, as I keep saying, are the best public health officers I've ever seen. And therefore, that education of women, increasing women moving from primary to secondary school to college, has also come with major developments in access to health services. And all this is supplemented by, of course, by having more health workers, and these health workers have increased access. But the last one I'd like to talk about is technology. Now, technology access. In Africa, we have huge access to mobile telephony. What this has allowed us to do is to use this platform of mobile technology to reach more people faster. Reach more people faster with training health workers, including community health workers. Reach more people with information, pregnant women to know when to go for antenatal care, when to take their children for vaccination, and also allowing us to reach people we can reach physically through telemedicine. All these things collectively are making healthcare delivery in Africa much more purposeful and much more visionary and much better outcomes.